Okay, so now we will be looking at glomerulonephritis and nephritic syndrome. Okay, so definition of nephritic syndrome and glomerulonephritis is intraglomerular inflammation and ranging from focal proliferative to diffuse proliferative to crescent, and clinically glomerulonephritis present with the features known as nephritic syndrome. Now, in nephritic syndrome, hematuria most commonly occurs with dysmorphic RBCs in the urine cast, hypertension, oliguria, proteinuria, and edema to the feet occurs. Causes are ANCA positive vasculitis, vagus granulomatosis, microscopic polyangiitis, Churg-Strauss syndrome, anti-glomerular basement membrane, and Gus-Pasteur syndrome, anti-GBM disease. Immune complex disease is a renal limited disease in which post-streptococcal glomerulonephritis, membranoproliferative IgA nephropathy, and rapid progressive glomerulonephritis occurs. Systemic disease of nephritic syndrome associated with SLE, chiroglobulinemia, and subacute bacterial endocarditis with henochannel purpura. Now, coming to the first glomerulonephritic disease and nephritic syndrome, that is post-streptococcal glomerulonephritis. It is type of post-infectious glomerulonephritis. After infection, glomerulonephritis occurs after 1 to 2 weeks. Sore throat occurs, and because of GBA hemolytic streptococcus pyogenes, then there is the glomerulonephritis occurs, in which ASO titer is elevated, serum C3 complement are decreased. So this disease occurs, and the but, lab investigation will be biopsy and electron microscopy, fluorescent microscopy. Treatment will be supportive antibiotics and diuretics should be given in this disease. Now, another disease is IgA nephropathy, also known as Berger disease. Most common cause of nephritic syndrome is IgA nephropathy, and notional purpura occurs in this, and it is associated with celiac disease and liver disease. Clinical features occurs in older children and young adults, and hematuria is there. Upper respiratory tract infection, gastrointestinal and urinary tract infection occurs in the IgA disease or Berger's disease. Diagnosis will be on the basis of light microscopy, electron, and fluorescent microscopy. Treatment diagnosis can be done. Same ASO titer is elevated and C3 complement is decreased. Renal biopsy shows hypercellular and large glomerular leukocytic infiltration. Treatment is supportive and antibiotics should be given.